Yeah, so the first slide is about just the title, what I'm going to talk about, opportunities or limitations for visually impaired physiotherapists. So what I will go through is my personal background and about something about the possible tasks which we were asked to talk about, and then I try to tell you a little bit more about what has helped me to become a physiotherapist and the things that or tasks that are excluded or difficult for visually impaired physiotherapists, and things about what is important to keep in mind, and how, and I'll tell a little bit about how I make observations without my sight. My background is that I've been working as a physiotherapist for 23 years. I was educated in the good old days when there were some more support for visually impaired students at the school in Copenhagen. So I also went through a 3-month pre-course before I entered the study. So I had a small advantage compared to my sighted fellow students when I started. That was nice for me because I had tried to walk around in a hospital before I started, and I knew a little about massage and muscles, and well, I had tried to have a patient between my hands before I started. And I've chosen to work in public clinics and hospitals, and now I'm working in a municipal rehabilitation center, and I've done that for the 9 past years. And well, as everybody say that, or most of us here, we have the same authorization as other physiotherapists in your country. And for me, it's always been important to have colleagues to discuss professional matters. So I've not want to stay alone in my own clinic and just do my own things in my ways. I like to have the challenge or be challenged by my colleagues, and also somebody I can ask. I use JAWS on my computer. It's nice for myself, but it's not fully accessible with the reporting systems. So I have a personal assistant who can read loud the reports, what we get from hospitals and other places, and then they put in my notes in the reports. So what about the possible tasks? The possible task, I think it's very individual. It depends on your interests, and it also depends on your personality and how much vision you have left. I think people with some more sight than I have are able to do more things than what I do, but so I think it's very individual, so it's very difficult to point out things that are impossible, but we'll get back to that. But some of the tasks are obvious, the giving massage and doing the manual therapy. That's very obvious that you have good possibilities to do that with your hands, because you are usually using your hands. Most people say, oh, you have such nice hands, or maybe they already think that, oh, a blind person must have very sensitive hands. So I don't know, but people usually say that I'm doing good with my hands. I'm nowadays working in an area where I do not use so much massage, or manual therapy. I use more training therapy, giving out programs to my patients. Many of these programs are not accessible with the JAWS, so what I do, I give my patients a pen and a paper, and I tell them which exercises we have been going through, and I tell them to make their own notes, so it's more personal, so they write it down themselves. So hopefully they better understand what they are supposed to do. And of course, well, you can take different tests with your stopwatch, with large numbers, or I have a talking stopwatch, so I do a lot of some of the testing from the senior fitness test, like the 6 minutes walking test, or some of the other tests, how many times are you able to get up from the chair within 30 seconds and things like that. That kind of testing I do. And of course doing correction of posture and walking, it's possible to do, and adjusting walking aids, and there are many other possible tasks to do. So I think when I was supposed to do this presentation, I got to think about what has helped me to become physiotherapist. So one of the most important things is having role models. One of the first things that I did when I was in this pre-course, they presented me for blind physiotherapists who told me what they were doing, so I got a good idea of what was possible to do. And I've since then, well, it's some years ago now, but I've been used myself, and I've had some visual impaired students who either want to go start studying or are already studying, who came and followed me for a few days, so they got a good idea of how I did things. And I had some more support, like Anne told about. We had this teacher who was supposed to help the visual impaired students, both at the school and also at the clinical places. And then I'll talk a little bit about tasks that are excluded or are difficult. So what I think is difficult is of course to observe people from a distance, like observing people in a working situation. I wouldn't do that, so I don't try to find a job in that kind of area. But the difficult tasks that I don't like to do, and that's probably individual as well. I don't like to treat patients who do not have a language, like people with the severe neurological damages, or it could be other persons who do not have a language. And persons with very low cognitive skills. I work in a rehabilitation center for older people, and sometimes when I go in there, I don't tell them that I'm blind. I just come in there with my white cane, and that's the first examination, because those who notice that, well, she's blind, she's using a white cane, they have a quite high cognitive skills. So that's a way of examining people. And then I don't like to treat aggressive persons. I have tried, it's not so much. And of course, of unconscious patients who are in the intensive care, it's maybe not such a good idea, because there are a lot of machines, you have to watch all the numbers and things like that. So for your own sake as well, maybe you shouldn't choose that. So what I think is important to keep in mind, and what I didn't put at the slide, is that one of the very most important things, that you have to be aware, and maybe also tell your surroundings, that it probably will look differently when you are doing your physiotherapy than sighted people when they are practicing their physiotherapy. So it's important to say that, well, I think I come to the same conclusions, but it may look differently, or I will go another way to find my conclusions. And like we also talked about in this morning, that you have to be aware of your own physical abilities and be well-functioning motorically. And you have to have very good communication with your patient and your colleagues. Have good communications with the patient. They are very good of telling you what the problem is, so you have to be very good at listening and asking good questions. And of course you have to also write down and keep good reports for your own sake and for your colleagues' sake. And if there should occur some kind of problem later on, it's good that you can go back and see what you wrote down about your treatment, your last treatment, so it's very important. And then finally I'll tell you a little about how to observe, which physiotherapy is very much about. It's observing people, how they are moving, and maybe guide them back into the more normal way of moving. So use your hands and your ears and your feet. I very often use my feet when I'm testing somebody, how they stand, and so I don't have to lean down. I just use my feet and your ears and your whole body to observe. And of course that helps to have a lot of experience. So it's just to get started, I think. And then like I told my group this morning at work, when I train mainly elderly people, and they find out that the physiotherapist is blind and has some limitations, my patients, they think, okay, then I better pull myself together and do a little more, because my therapist, she is not fully capable of everything. So people find some resources in themselves when they are treated by a person who do not have the full vision. So that's more or less. Well, maybe I should say that. Well, maybe this sounds very easy, but of course, no, it hasn't been easy. I'm not working full time because that's too much. I use a lot of energy when I'm working. So I just have a part-time work on special terms, but I'm very happy about what I'm doing, and I'm sure if you ask my colleagues, they are very happy about my work as well. So thank you.
I have one question for you. How do you measure range of movement with goniometer, or how do you do it?
The movement in the joints?
Yes, the joints and the ankles.
Yeah, I use a normal measure, and then I ask the patient to read what it says.
Okay.
Or I just use my kind of eye, or my impression is, do we have an angle of 90 degrees or 45 degrees? So I'm maybe not down to the small details. Is it 32 or 35 degrees? But if I need to do that, I just use a normal measure and then ask the patient.